A new hospital under construction in Vancouver, a modern facility for healthcare and its delivery, getting access to treatment and having timely care, and simply being able to have a doctor to turn to are all top concerns in this election campaign. Just ask healthcare workers.
Really, it's about shortages and the challenges that are existing in hiring, retaining, and recruiting the staff that run these operations.
So when family doctors are not properly resourced or supported, it impacts the quality care that the patients receive.
Decisions made in the early 2000s in terms of not investing in nurses, not investing in nursing schools, and not investing in healthcare has really contributed to why we're in this situation right now.
Party platforms have pages and pages dedicated to healthcare, making it tough for voters to figure out what will make a difference. All the parties agree bold, creative solutions are needed. The NDP would continue pushing to train and retain more family doctors and nurse practitioners and connect them with the hundreds of thousands of people without them as quick as possible. The Conservatives want to increase care through a new model, one that delivers services through both public and private facilities, but universally funded by the province. Meanwhile, the Greens are promising a so-called dogwood model, 93 healthcare centres across the province to which people are directly connected for the majority of their healthcare needs. The bold plans and the platforms don't come cheap. Healthcare is the province's top expense, with nearly $33 billion committed to it in its current $89 billion budget. All three major parties have promised to increase spending, committing hundreds of millions of more dollars in an attempt to improve healthcare services. Still, that spending isn't guaranteed to produce results. Statistics show BC has struggled to reduce wait times. In 2021, nearly 90% of cancer patients got access to radiation therapy within benchmark timeframes, but that dropped in 2022 and even further in 2023. This as health spending increased. The BC NDP defends its work to improve health care and has been asking voters to allow it to continue with its initiatives, saying they are making a difference. The other two parties hope to tap into voter angst, something healthcare workers understand.
As voters, and I don't blame patients for this. If I'm in my community and I go to the emergency department because my son fell out of a tree and broke his arm and the emergency department is closed, I'm angry and I want change.
Mitchell and others say the last BC government has made progress and they want to keep going with the BC NDP. A group of Surrey doctors say as much in an open letter, writing they have found common ground and made significant progress and want to maintain momentum on a new hospital for Surrey, a new regional cancer centre and more long-term beds among other investments. Healthcare workers say promises and platforms are needed but must come with the proper resources such as additional workers. Nurses want whomever forms the next government to guarantee newly established nurse-to-patient ratios in hospitals, which paves the way for the hiring of 8,000 more nurses. Both the NDP and Greens have so far agreed to this.
What we need to see to turn our healthcare system around is more policy solutions like minimum nurse-to-patient ratios. We need to do things that are going to ensure that patients get the care that they require and that the conditions of work are as such that nurses actually want to stay in the system.
Healthcare workers want voters to closely look at the party's platforms as they prepare to cast their ballots. In the meantime, they also say they're willing to work with whomever forms the next government, as long as there's no backing away from a problem that requires bold solutions and the resources to make a difference. Chad Pawson, CBC News, Vancouver.